we've got nothing but worse outcomes and higher costs in the last, 15 years. I think it's time we try something new. Like, let's get the MBAs out of the decision maker seat and let's put physicians back in it, because healthcare needs to be about health first and business second.
Hey folks, welcome to another episode of the Healthy Savings Podcast. I'm Sasha Grubov. I'm your host. I'm the founder of Milu Health, and we're joined today by Nick Lease. Nick is the founder of Next Gen Benefit Solutions. Nick, thank you for coming on the podcast. It's great to see you.
Absolutely, Sasha. I appreciate the invite and look forward to having a conversation today.
For everyone who's tuning in, Nick and I just did a little pre-show chat. We're filming this right after Thanksgiving. It'll come out a little bit after the fact. But we were going back and forth on the value of turkey, and is it a good meal or a bad meal? Is it worth the effort? Is the taste up to par? And I think we both landed on it's kind of like healthcare, where it's overbuilt a little bit and probably not quite doing what it should. You agree, Nick?
I could not agree more. And I love the analogy there of tying it back to healthcare. Turkey is the staple of the Thanksgiving meal, and it's really the status quo. There's some families that have gotten away. Maybe they're a ham family, which is getting a little bit away. But then you have the people that are doing things like prime rib, or maybe they're doing a completely different cuisine altogether to celebrate the holiday. And I think that's a great tie into healthcare. That we've kind of got this status quo. We've got the old turkey in the house. And I think one of the things we're going to address today is, how we can satisfy the holiday or take care of what people need in a little bit different way other than the turkey.
I mean, the turkey's setting the house on fire, and it has been for a few years. So I agree. I think it's a good analogy. Well, to kick things off, we usually start just by hearing about you and your background. Like, how did you get into this world of employer-sponsored healthcare, and how did you start your own firm? Because that's not a small undertaking.
Some great questions. So to kind of give the clear back to the beginning, I always like to tell people I came out of the womb questioning everything. So I was that kid that was in trouble more frequently than most. And a lot of times it was because I was questioning the status quo. So I grew up here on a ranch in Western Nebraska. Honestly, could not have asked for a better upbringing. Two great parents that really helped pointed me, I should say, in the right direction. And I was able to kind of take it from there. So after I got through school, moved to Wyoming for a while, went to college for a bit, and then wound up coming back to essentially what is my hometown. For about 7 years of my professional life, I actually worked in a state prison system. So I worked for the Wyoming Department of Corrections. And a lot of people are like, what's that translation going into employee benefits? Well, at the end of the day, part of my business is sales. And when you're working inside of a prison system, I always like to tell people it's high risk sales. You're taking a population that historically does not like to follow rules or laws. And you have to figure out a way to work with them to help them see that your way is really best. And that's the best for them. And that's the best for us. So really, I learned a lot in that setting. But after 7 years, also having a 7-year-old daughter, I realized I was missing way too much. The prison setting is a shift work environment, 12 on, 12 off, doing 4-day rotations. And I got tired of missing dance recitals and soccer games. And so it was like, a dad is the most important piece for me. So what do I do about that? So I actually took a massive pay cut, started working for a mortgage servicing corporation. Was a really great experience, kind of started to cut my teeth in the actual business world, and I learned a ton. But the one thing that I found after about 2 years was that I wasn't cut out for life in a cubicle. Really wanted to get more sales focused. So through some connections I had was told, why don't you apply for a job at this local agency? They're looking for an account manager. So did a couple of interviews. At one point in time, told them I would run the vacuum cleaner if it meant I could work for them. And they said, well, let's do better than that. So I actually didn't get the job I interviewed for, but later was brought on to run what was their life and health department. And mind you, I came into this with having a little bit of insurance knowledge from the mortgage tracking side of things, but I didn't know anything about health insurance beyond that it was something I elected once a year and tried to make the best decision. And instantly when I got into the business is when I really started challenging the status quo, started looking at why are we doing things like this? Why are we telling business owners that Blue Cross Blue Shield is their only option? Why are we telling them that fully insured is their only option? How do we, in our right minds, go in and tell these small businesses that are just, they're trying to make an honest living. They're the backbone of America. And, oh, by the way, you're going to take a 15% increase this year because you don't have any other options. And so that was circa 2018. And I really I fell off because I'm like, there has to be a better way. The questioning was going on. And I wound up finding a book by a guy who was, unknowingly became kind of my mentor, which is Dave Chase. So in 2018, he wrote the book, CEO's Guide to Restoring the American Dream. Quick side note there, if you haven't read that book, it's a must read. It will really open your eyes up into a different thing. All of Dave's other books are fantastic as well, but that one was the one that started it. And I read about these different companies and this different ideology that Dave put out there from lots of tireless research. And I went, why not my clients? Why not my community? The things that Dave's talking about of lowering healthcare costs, delivering a better benefit to employees, like, why not my community? Why not my clients? So at the end of 2022, I kind of had a vision for what I wanted to accomplish in my life. And the setting that I was in at that point in time just wasn't going to be conducive to really creating the grand vision that I wanted for me, my community, my family. And so it was time that I had to take a bet on myself. I had to put all the bets and all the money on Nick. And so I walked into my job one day where I was making a very comfortable salary, and I said, I'm done. And I walked out, and within a couple of weeks, I had Next Gen Benefit Solutions opened up and really just focused on not only serving my community, but other communities that are frustrated with the status quo.
I couldn't agree more with you on so much of how you approach this stuff. First of all, I also read Dave's book, and it was a huge thing for us as we were just getting Milu off the ground and understanding, like, we had a pretty good sense for what's broken. We didn't quite know how to fix it. And so it was just amazing to see, like, no. The answer's there. Like, it's been done, and it's been done slightly differently in different places. And the same answer doesn't work for everyone. But the formula is there, and you got to go and leap and implement it and learn. So that's been awesome for me to see as well. How do you think about having these conversations with your groups? Like, as you come across an employer that you haven't worked with before, and let's say they're on a traditional plan, and they've been dealing with the same old rate increases. Like, how do you start showing them? And they've never heard of Health Rosetta, they've never heard of reference-based pricing or direct primary care or any of this kind of stuff. Like, how do you start that conversation with them?
Well, sometimes the conversation, Sasha, is very short and to the point. One of the questions I ask is, how do you feel about health insurance companies? That's one of the first questions I ask because it's going to uncover a lot. And the answer almost unequivocally is we hate health insurance companies. It's like, okay, so we've got an alignment there. Now, my next question for you is, have you tried anything different? Well, we've raised deductibles and we've, passed premium increases along to our employees. Okay, that's great. Have you tried anything truly different? Or have you tried using an independent third-party administrator? Have you tried using an HRA strategy? No, we haven't. Well, what's your biggest holdup to doing so? Our employees like Blue Cross Blue Shield. They don't like change. That right there, a lot of times distills whether the conversation moves forward or not. If we have a company that, they don't like the system, but they're not willing to change the system, I'm a realist in the fact that we can't change the world in mass swaths. We have to find the people that are really interested. But the other side of that conversation sometimes elicits like, no, we haven't tried other things, but oftentimes it's because we don't even know there's other things. And I'll apologize on behalf of brokers is that while there's a lot of really amazing brokers out there, there's a lot of people doing really good things. I've got some amazing peers, and quite frankly, I've got peers that I don't want coming onto my turf because they're rock stars. That being said, there's plenty of people that are willing to sit back in their leather chair, continue to wear it out, and collect a nice paycheck without working too hard. And when we run into those situations, that's where those clients, it's not that they don't want to try something new, that they're not willing to try something new. They don't even know that new or different exists. They've been told this is your option. Once we start getting people like that, they start asking those questions. Well, what do our other options look like? And I think one of the really important pieces that is part of that conversation at that point in time is explaining to them why we are where we are. And when you're talking about that traditional health plan, when you're talking about, what is going to be what we would call the BUCAs, the big health insurance carriers, probably a fully insured plan, especially in groups under 100, is explaining to them how the Affordable Care Act is working and how the results that we're getting aren't by accident. It was strategically designed this way, and I don't think it was necessarily malicious. I just don't think all of it was thought through. And so what we look at is what are the critical failures of the ACA? And this is where a lot of people's minds really get blown. Number one, if you're a group under 50, the insurance carrier has to spend 85% of the premium dollars collected on claims. And we all sit there and think about that and go, well, that's not a bad thing. We want them paying out claims. That's why we're buying health insurance, is so we can use it. But when you flip that context and you look at it from the other side of saying we're capping the health insurers rate, and I have to back up for a second. I apologize. Under 50 is 80%. Over 50 is 85%. But regardless, when we step and we look at it from the other angle and we say, okay, we are capping the insurer's profitability at 20%. That's when the business mind really switches on for people and they go, wait a second, we're capping the amount. So if they can never have more than a 20% operating margin, how are they going to grow their business? That's a great question to ask. The only way they grow their business is if you pay more.
You ask any business owner that question, and they take it back. Okay, great. I sell widgets. Yep. And if I've got a fixed margin on my widgets, what am I going to do?
You either have to sell massively more widgets, or you have to raise the price of your widget. That's the only way you can do it. And let's just be realist. Creating more market share, although some of them do it with the big four health insurance carriers. They're not going to take on another 15% market share in a given year. Maybe over a decade they will, but we won't get into all the predatory stuff they're doing to try to do that. But really, the only way for them to make a surefire higher revenue next year is for them to have higher increases on your health insurance. And so, again, that's an important thing. I think people, I think a lot of people maybe understand that they have to spend a certain percentage on claims. But when you took and you look at it from the business angle, that's really the key to me of getting that business owner going, I understand now why our rates never go down, because they're not going to make less money and they're not creating enough gain in market share to offset any cost reductions they could do. So once we look at it from that angle, it really starts to make sense for business owners. The other critical failure of the ACA, in my opinion, is that we have the unlimited cap. So if you talk to actuaries and underwriters that have been in the business for 25, 30 years, they'll tell you prior to the Affordable Care Act, very rarely did anybody breach the $1 million limit on their health insurance policy. Occasionally somebody would, but it was a very, very small fraction of people that actually breached that. Now, I won't go into it today, but we don't want that scenario. We don't, even if it's a small fraction of our population, we don't want that scenario that those people were forced into doing spend downs and going on Medicaid. It was a broken system. But again, for the masses, very rarely did that ever get breached. As soon as the Affordable Care Act was implemented, the amount of $1 million claims we started having just started going through the roof. I mean, it's growing at a rapid pace. And it's not unheard of to, see $2, $5, $10 million claims in a given year. And a lot of it is because we don't have any caps. There's no checks and balances of it. And so from an insurer under the Affordable Care Act, we can't underwrite you. We don't know what type of health you are, especially in the under 50 in most states or under 100 in all states. They can't underwrite you. So we don't know what kind of risk we're getting. And we have no top end. We cannot control what our top end is. So if we have, 100 members, we don't know if they're going to cost us $1 million a piece, 100,000 a piece, 10 million a piece. And so by really looking at that and then asking that question of, okay, how do we ensure that we never even get close to $1 million in spend, which is completely doable in the majority, again, talking masses, it's very easy to control a lot of those things. And it comes down to how we're paying for it. So to kind of put a pin in that particular one is, helping employers understand how the loss ratios actually work and why, from a business perspective, it's doomed for failure. And then two, helping them understand how these catastrophic risks are the ones that are actually driving our costs. The cost of healthcare really isn't that expensive unless you're overpaying for it.
That's fascinating. I've been in this space for a little while now. We started Milu over 2 years ago. I had not heard that second one. Like, I did not realize that there was typically $1 million or so cap before. And yeah, if you pitch that to me, I'd say, no, that's terrible. We gotta get rid of that, right? Like, that's the right policy for the country. Except when you get rid of it, the number of over $1 million claims skyrockets, because now every drug maker is going to go and say, hey, there's a good chance this thing's going to get paid for. Whereas before, if there was a cap, they're not going after, an employee somewhere in the country who hits that cap and then can't pay another $1 million for their hemophilia medication. They're going to find a way to work it out 99.99% of the time. And the person's going to get the medication.
And I want to make the point, like, we need to have that social safety net, even if it's, 0.001% of the population that would ever exceed that million. The safety net that we had in place was not a great safety net. I'm not going to argue that. I just think that the way that we went about it, we were planning for a very, very small sliver of the people and not the masses. And so I would be in favor of, let's rework what the safety net looks like. But you hit the nail on the head. The ACA allowed, health systems, pharmaceutical companies, all these different players. They realized, wait, the insurers are an unlimited coffer of money. They can't stop paying the claims. So we can really charge whatever we want and as much as we want, because on one hand, they have to lose either 80 or 85% in the fully insured market. So they have to pay the bill because they have to hit their loss ratios. But on the other hand is they can't stop paying. We can take them to the cleaners if we want. And I'm not saying that that's, nefariously happening. It probably is, but I'm not going to make those accusations. But when you look at the data would say prior to the Affordable Care Act, $1 million claims were an oddity. After the Affordable Care Act and that cap was lifted, they became pretty common, quite frankly.
Fascinating. My background before Milu was in the biotech world, not drugs, but diagnostics. But I got to see some of these new drugs that are coming out for cancer patients that are expensive, but work miracles for a small subset of the population, right? Like for a patient with metastatic non-small cell lung cancer that's not responded to 2 prior therapies and has a specific mutation in a specific gene. And like, that's incredible. And by the way, our country is like the place that stuff happens. It's like our country, a few places in Europe and Japan, and that's it, and maybe a little bit in China. Like, we do that. And there's been plenty of political stuff talking about how we fund that for the rest of the world, which is another problem. But the answer isn't for all those things to cost over $1 million. You know, like there needs to be some middle ground where there's still an incentive to go and develop a drug for, you know, a population of 100 kids a year that have something very rare. Like, we need to go and help those people because the science is getting there.
Yeah.
But we have to do that without blowing up our healthcare system. And there's some answer. Like, I do think that there's some way of getting there.
And I want it to get there. That's the thing about it is that, you know, yes, I want to control costs. Yes, I want to make sure we're doing evidence-based treatments and, you know, using common sense when we're consuming healthcare. But at the same point in time, like, one of the things, you know, we just got done with Thanksgiving. One of the things I'm thankful for is that I do live in the United States of America. I'm thankful that we are the world's leader in some of these progressive advancements in healthcare and everything else. The problem really comes down to is that, again, with the Affordable Care Act and some of the misalignment of its incentives. And I know that that's a little bit corporate speak to some, but really, if you incentivize people with the wrong things, they will do the wrong things because, you know, they're chasing the almighty dollar, which chasing the dollar is not a bad thing. And so I think the fix is there. I think that we can be the world's leader in these new technologies, this progress in healthcare. But we do have to do things a little different. You know, one of the things that I'm worried about, and this came from an underwriter I was able to listen to a couple of months ago, is a lot of the gene therapies. You know, there's very few on the market that are FDA approved right now. You know, that's going to increase 5, 10, 20 fold over the next decade. These are very expensive therapies. They're very critical to the people that need them. And so I want to figure out, how do we deliver the care that these people need? How can we help them live the most healthy and productive life that we can? But how do we do so sensibly? And I could jump up on a soapbox and give you a whole bunch of different ideas that I have, but I don't know that any of them are fully baked. But I think that's where having these conversations, you know, the conversations in the communities that you and I are involved in, is how do we achieve both? How do we keep it affordable? How do we not go bankrupt trying to help people? But how do we also make sure that we're delivering a healthcare experience that nobody else can provide, or no other country can provide, that we are strategically the best suited to deliver it?
So I'd love to hear a little bit about your community. Like, you're in rural Nebraska. What's your community like, and what's healthcare in your community like? Are there a few major systems that, you know, control everything? Are there a few carriers and networks that control everything? Like, what does it look like?
You know, I will say that we're not facing any challenges that any of my peers or any business or any other community is really facing. You know, I don't think that we're unicorns, but to give the context, you know, I hear a lot of people talk about, you know, I'm in rural America, and I chuckle a little bit. So let's talk a little bit about geography in Nebraska. So, you know, Nebraska is about, I believe, 2 million people strong. But at least half of those are in 2 cities. You know, so when you get out to western Nebraska, the panhandle of Nebraska, the entire panhandle is 80,000 people. That's a small town in some parts of the country. And that's our entire, I believe that's about 80,000 square miles. So that there's about a person per square mile. You know, and then you get into my county, which is Scottsbluff County. There's about 40,000 people total in the county. But then when you condense it into what we would call the sister cities of Scottsbluff and Gearing, you know, total population is probably about 20 to 22,000. So again, if you look at the population of my county, there's city blocks in places like New York that have as many people in a city block as I have in my entire county. So we have a unique challenge in the fact that we don't have the masses, and one of the things that you need to create change is you need plenty of people that are all wanting to row in the same direction. Now, we don't have a ton of people, but we have a very passionate amount of people and people that are kind of fed up with it. So when we start looking at, what does it look like in our community today? We've got one health system. And slight side note, Nebraska actually has some of the highest amounts of nonprofit independent health systems, which is a really good blessing and a curse, all in the same sentence. But, we've got one health system here locally in our community. There's a couple of other smaller health systems in tertiary communities throughout the panhandle of Nebraska. But we really have one access point. We don't have a lot of independent. We don't have direct primary care physicians. We don't have outpatient surgical centers. And so, we're faced with kind of a dilemma. Can we figure out how to work with our current health system? Can we, get the quality we want, which is something I always lead with. We want high quality, but can we also do it at a price point that we can afford? And unfortunately, here in my community right now, that's been our biggest challenge, is how do we work with what we have? There are some things that have changed over the last year or so, and starting to give me more hope that we will be able to truly do that. But one of the things that we have to look at in our community is medical tourism. Now, when we talk medical tourism, a lot of times people are thinking, oh, we're going to Mexico or, Costa Rica or someplace. That's not what I'm talking about here. That has its place. But what I'm talking about is, where can we reasonably go to go get healthcare, but we're going to have to travel for it. A lot of people are traveling, from where we're at in the world. They're traveling into the Front Range, Colorado for, fun, sporting activities, shopping, just trying to get a meal that they can't get here in town. So people are naturally going down there. And one of the things that we've seen over the last decade is more and more people who are really focused on the quality standpoint. They want to consume high quality healthcare. So they're using some different outlets in the Front Range of Colorado. So that's one of our biggest things, is how do we help people understand the full context of the problem? One is that we want to get high quality, which I think the market has kind of already figured out themselves. They're kind of already self-diagnosing that portion of the problem and have built their own remedy in the fact that they're already traveling. But the second part is, just going to an independent surgery center in Colorado doesn't fix the problem. Yes, we're probably getting better quality, and that's the most important part, but we need to know where you're going. So one of the things that we're trying to incubate here locally is, building our health plans to actually incentivize people, if we need to travel for healthcare. And so we're doing things like waiving cost shares, maybe giving gas cards, just doing anything we can to help employees go purchase care where they want to purchase care, making sure that it's high quality, but using things like direct contracts and cash pay to bring down the cost of those. The way that a PPO network works is that the health system sets a price, and it's an arbitrary number. I jokingly say it has no connection to reality, and I don't know how much of that is a joke. But it's not unlikely to see a service that is marked up 3,000 to 5,000% by a health system. And why do they do that? Because they know the health insurers are going to come in and they're going to ask for a discount. So if they mark it up 3,000 to 5,000%, and the health system comes in and negotiates a 50% discount, well, the health system's still making a boatload of money. The insurance company feels like they got a really good deal. Yet the problem is we're still way overpaying. So when we're using direct contracts and cash pay, a lot of times we're starting at that reference point. We're saying, okay, what is Medicare doing? We're engaging with the healthcare providers and saying, what do you need to make? And quite frankly, if we're cutting the insurance piece out, we're using cash pay, we're using a direct contract, paying them directly, a lot of times you're going to see the prices for healthcare be 50 to 70% lower than the PPO networks. So an example I always use is here locally. If we do a total shoulder replacement at the local health system, we're looking at spending about $60,000. One of the clinics that we love in Colorado, super high quality, we can purchase that same total shoulder replacement somewhere between $20,000 and $25,000. So again, saving 50 to 70% is not uncommon over the PPO network rates. And then when we look at
And by the way, my guess is that lower price also includes like readmissions, right? Like they're generally covering all in. If something happens.
100%, and I'm going to get off a little bit on a tangent here, but that's part of looking at quality. And when I'm sitting down and explaining what's wrong with the health system to business owners, and especially their employees, because their employees want good quality, they say, well, how do we know that the quality is better at the surgery center than this health system? And one of the first things I always tell them is, what's easier to keep clean, an 800 square foot house or an 8,000 square foot house? Well, everybody's going to say the 800 square foot house, and it's for obvious reasons. It's less space to clean. So nothing against hospitals or big health systems, but they've got these massive buildings. They're a lot harder to keep clean. And so when you look at the data, readmission rates, infection rates are higher in these facilities. And although it comes more than just cleaning, when you've got 800 square feet that you're trying to keep clean, it's a lot easier to keep those bad germs and bugs out. So when we go to these outpatient surgical centers, we're seeing statistically they have lower readmission rates, they have lower infection rates. And one is, I think they're just really well ran. But again, it comes down to it's a smaller house to clean. So it's
also funny, like when you talk to doctors and you ask them like, hey, where did your loved one go for that surgery, for appropriate surgeries, right? You're not going to do a heart replacement or bypass, not a heart replacement, a bypass surgery in a surgery center. But my father-in-law is a eye surgeon. And I was talking to him about surgery centers, and they had a joint replacement in the family, and where'd they go? The surgery center, where he knew the quality was high and he knew the surgeons that ran it. And like, that was the best decision. And they live in a city with, 3 major health systems in the area. So it's a great option.
This is the irony in this, Sasha, is that a lot of times, especially in the bigger areas where there are surgical centers, we see one of two things. One is that a lot of times that the provider that could do it in the major health system in your town also operates out of that surgical center. So it's the exact same surgeon, but the prices are completely different. And again, going back to, really big house versus small house, what's cheaper to heat in the winter? A small house or a big house? So the overhead at the surgery centers, the independent surgery centers, are so much less. And so they don't have to charge as much. So sometimes you can get the exact same surgeon that you would get at the health system, but you're doing it in a place that's more cost effective. So that alone can save you. That's one thing that we have to look at. But the other side is efficiencies. One of the beauties, talking about Milu for a second and having Milu involved in the health movement that I'm a part of, is that unfortunately, we're going to have a bunch of silos at some point in time across the country, as there's people like me doing different things. The one thing that can work faster than any of us is AI. And so that's why I'm so bought into Milu and the fact that, do you guys necessarily have the solve for everything today? No, you don't. But by having a learning model in place to understand what's happening across the country, we can distill that down and make it easier, at a mass scale to bring change at a mass scale, because you can tie all these different pieces that we're doing across the country together.
But you know what, Nick, just back on that piece, from our perspective at Milu, we can work with any kind of plan, right? We have clients who do Buka plans and we work with them. But what I love is when there's plans that are really smartly constructed, that focus on quality, that are specific to the patient population, and if it's a regional group, to the region, and that put the right incentives in place. Because it's one thing for us to direct care within a large major network. You could do it, but you're going to have limited impact. It's another thing if I can go to an employee and I say, listen, when you connect your health record to Milu, which you can do with one button.
Which I love, by the way.
Thank you. We can then go and identify when there's a thing to help you with. And by the way, when that thing is a major surgery, you've got a plan that gets that to you for free. You're not paying $3,000 out of pocket, and you're not going in blind and not knowing quality data. You're going to a high quality place. You can sometimes pick between a few high quality places, and you can go and get that done for free. And that's huge. By the way, plus a gas card, like that's amazing if you have to go and drive out there. When you have those kinds of plans, like that makes the technology work. The technology without that kind of plan and incentive structure is very limited, but putting the two of them together, it can really, really impact some real change.
You're bringing up a really good point that I think we need to touch on, Sasha, is helping people better use their benefits, which is, as you know, one of the big reasons that I'm bought into Milu is because I think Milu can help people get what they need. Really, I look at Milu as like a high-touch concierge service. I always tell people, NextGen's built really on three core pillars. One of them is cost containment. We've talked a little bit about that of, how are we solving the cost problem? Another one is compliance. We got to make sure that we're following all the rules. We got to make sure that we're navigating the laws and regulations that are out there to keep groups compliant. But a third piece, and this is a highly critical piece that I see a lot of businesses, quite frankly, failing at. And it's not necessarily anything they've done wrong. It's just a complex problem that a lot of people haven't solved. And Milu is solving one of these problems for us, which is our employees, unless our employees went somewhere that you and I didn't go to school, Sasha. In elementary school, I didn't learn anything about navigating the healthcare system. Junior high, I didn't learn anything. High school, I didn't learn anything. College, I didn't learn anything. So what I'm getting at is that we never had a course. We never had any training. We never had any type of education on how to navigate the healthcare system. And the healthcare system is arguably unbelievably overly complex. I don't think it needs to be as complex as it is. Part of the reason for the complexity is that when you make something really complex, people throw their hands up quicker and say, well, just, it is what it is and go on with life. But the point I'm trying to make is that our employees don't inherently know how to navigate the healthcare system. And almost everybody that I've ever talked to, the only way that they truly understand how to navigate the healthcare system is by trial and error because they were forced to. And that creates a couple of really critical problems from my perspective. Number one is always about the people. Is that, are we creating more stress for our employees when they're in a time of need? Yes, we absolutely are. Are we creating more opportunities for them to maybe make a wrong decision because they just don't know any better? Yes, that's happening. And that, impacts their health. It impacts their finances. So that's a critical piece. But also looking at it from the employer standpoint of, I can sit down with my employer. I can sit down with Sasha and say, Sasha, here's the deal. We can spend $60,000 over here, or we can spend $20,000 over here. And assuming that quality, for all intents and purposes, is equal, why would we spend $40,000 more on the same thing? An employer gets it, but it's like, how do we help the employees understand that? And I'm just going to be very blunt. The average employee doesn't care. They don't want to understand. We're not going to create this massive, just super knowledgeable, nerdy about healthcare employee bases. And so it's how do we get in front of them at the time of need to give them just enough information, just enough education to solve the problem that they're facing today. And that's, again, where I'm all in on Milu. I'm trying to find more and more areas that I can work with Milu because I realize the value in that. It is so valuable. Again, quality first, but I want somebody to be able to text their Milu concierge and say, I need a knee surgery. I can tell you in the last 7 years, I have given employees a PPO network directory that has 700 knee surgeons.
And what do you do with that? You start
And they're
dialing
like,
them
no,
up.
we just wasted 40 sheets of paper.
Yeah.
What they really need is what Milu brings to the table, which is they need to be able to text, say, hey, I need to have a knee surgery done. I want the highest quality and I want the most cost effective. And they don't even necessarily have to do the most cost effective because, again, at the end of the day, the employee doesn't necessarily care. They should, admittedly, but they don't. So they're wanting high quality. So when Milu engages that, Milu on the backside is looking for that highest quality. It's also looking for that lowest cost, and it's giving 2 or 3, maybe 5 recommendations of here's some places to go, which is data that the average person can use. They can look at that and say, okay, I'm going to look up these 3 different surgeons, these 3 different, surgical centers that I can go to, and I'm going to make the best choice for me. When we give them 700 options, they just throw away the guide and waste 40 sheets of paper. We need
Exactly.
actionable insights, and that's why I love what you guys are doing. And I think it's so important for the health plan side of things, which is where I was getting to, which is we need to take how to purchase healthcare, both from a quality standpoint and a cost-effective standpoint. We really need to take that off the employee's shoulders. We need to give them the tools to do it where they don't even know that they're doing it. And again, I like to go down a rabbit hole occasionally. One of the things I want people to understand is, and this is just an interesting phenomenon, but time and time again, when we're looking at the highest quality, it's also the lowest cost. It's magical how it works out. The men and women who are delivering healthcare at a super high quality point and a very cost effective standpoint, they're my heroes. They need the Presidential Medal of Honor because they're doing great things. We need more of them. I want to work with more of them. But that's just an interesting side note I want people to understand is that high quality care
is not the most expensive.
Yeah. It is cheaper. I hate the word cheap. It is cheaper. But that doesn't mean that it's lesser. It's really an interesting phenomenon. It works nowhere else in our economy. When you buy a cheap set of headphones, you get a cheap set of headphones.
Yeah.
It's just interesting how healthcare works that way. But that's a point I want to make that people need to understand. When we're focusing on quality, for whatever reason, the cost just falls in line with it. So again,
and by the way, we also need a healthcare system that empowers those great doctors and those great nurses, right? Like we need plans that aren't running 5 levels of prior auths for silly stuff and creating crazy administrative headaches that like no doctor can go and open their own practice and surgery center without, crazy funding now. Like that's not how it should be,
100%. And anybody from the healthcare delivery side that wants to stay embedded to the status quo, like good on them. But I can tell you from my standpoint, and speaking for my peers across country, if you're a healthcare provider that wants out of the status quo, you're tired of, the same old thing. You want to have that freedom. You want to be able to do what you dedicated your life to doing, which is practicing medicine and delivering healthcare. Find us in your communities because we want to send people your way and we want it to be an equitable thing. That's one of the things I say is that I want to create an equitable system for everybody. I don't necessarily want to cheap out, and there's not a business owner I work with that wants to undercut somebody. They want to pay a fair price. That's their whole goal is we want to pay a fair price for everything. And so it's not that we want to come in and dictate, we're only paying you X amount. We'd prefer to have it be a fluid conversation to say, what do you need to make? And as long as it's reasonable, we're okay with that. And that's one thing that we really need to get to. And, again, going back to the government, which I probably should have prefaced earlier, I have no faith in things like the Stark laws and the fact that physicians can't own hospitals and can't run hospitals. Like I'm at a point in time where like we've tested the theory. The theory is that if we put physicians in control of healthcare, they're going to overtreat and drive up the bill, and it's going to misalign the incentives. So we put laws in place to stop that. We've got nothing but worse outcomes and higher costs in the last 15 years. I think it's time we try something new. Like let's get the MBAs out of the decision maker seat and let's put physicians back in it. because healthcare needs to be about health first and business second.
And let's get rid of all the laws that require state approval to go open a new surgery center, right? Like
100%. The certificate of need laws are, although I don't profess to be an expert in them, like, again, they just don't make sense. The irony is, and again, a slight side note here, I had somebody the other day on social media, compare the current healthcare system to Standard Oil. Now, I really like John Rockefeller. I've read books about him. I've just very interesting character. Absolutely ruthless businessman. I want to preface, I do not agree with some of the things he did from a business aspect in regards to his competitors, because he was very ruthless to his competitors. But we also have to look at the good side of things and why that's not a good comparison. So with Standard Oil, the cost of kerosene prior to John Rockefeller creating the monopoly that he became, kerosene was for the elites. Only the elite could have light in their house at night. The poor people couldn't. By the time Standard Oil came to its demise and got broken up, the cost of kerosene had just gone down substantially, and to where it was available to the masses. People don't take into consideration that, the waste from making kerosene often was dumped in rivers. Rockefeller said, wait a second, I can help lower the cost of kerosene further if I can find a way to use these waste products. And so he started creating petroleum jelly and all these other things. So it was better for the environment. He was able to, further his mission of lowering the cost of kerosene to make it more available for the masses. That's not what healthcare is doing today. The Affordable Care Act has created these monopolies that don't care about the patient. They don't care about our communities. They are there to appease Wall Street investors. And, you and I probably, passively through a retirement plan, invest in some of these companies. If I ever had the time to sit down, I'd figure out how to divest in some of these companies that are doing the wrong things. But really, at the end of the day, it's not you and me that win from, the healthcare or the health insurers having a higher share price next year. It's the large institutional investors that are winning on it. And so I know that's a little bit of a tangent, but I don't like the tying the monopoly there. But where I was going with that point, Sasha, is that, they broke up Standard Oil because monopolies are bad, and it creates lesser competition. And if you don't have somebody like John Rockefeller, whose mission is twofold: one, how do I get as rich as possible and have lots of control? But also, how do I deliver better to the American people, which he did on both accounts. If you don't have leadership that is looking at that both ways, the health insurers today, they could do the same thing John Rockefeller did. Healthcare is not expensive. Health insurance is. If they wanted to, they could solve the problem overnight, and they could do it in a way that would allow them to continue to thrive, but also allow the masses, the people in our communities, the people we care about, to thrive. But that's not the mission that they're on. And so I'm all about it. Yes, let's break it up. Let's get rid of certificate of need laws. Let's get rid of, the ban on physician-owned hospitals. Competition, by and large, is always a good thing. And the Affordable Care Act and some of the decisions that have been made around it really hurt the ability to create that competition. And that's why we see three PBMs controlling the majority of the market. That's why we see, 4 insurers controlling the majority of the market, because we've created a system to where that's where it went to. So yeah, I'm all in favor of it. I'm a big believer in defunding BUCA. I'd like to see those things happen, but I also am not going to sit here and complain about it. We're taking the system that we currently have and we're figuring out how to make it work for us.
And for the employers in your communities.
Yeah, exactly. And so, we can sit here and wait for the government to do things. That's not my style. I'd rather figure out, with the rules and regulations that we have in place today, how do we make it work? And we're doing that. We are achieving the goals that we want. We're seeing costs come down. Sometimes I had a group just the other day that I brought on. We saved them 40% over what they were doing.
That's amazing.
And it was all just from tweaking a few things. Quite frankly, most of the tweaks we made, Sasha, had zero impact on the actual employees. The biggest two impacts that the employees had were both beneficial. One, their premiums went down. Two, their deductibles are slightly lower. Hoping to go down lower with those deductibles over time. But again, it was just, there was a lot of misalignments once we were able to kind of recreate what we wanted based on the goals that we had. Those costs started coming down. So again, I think advocacy and lobbying is an important thing. It's something that I spend a little bit of time doing. But the main thing we need to do, and looking at how change happens, there's two ways that we can beat the bukas. Number one is we can hope that politicians do the right thing and create laws that, make a competitive environment and hold them accountable and la. Again, very little faith that's going to happen. The other thing that we can do, which is way more impactful to insurers, is we can take away market share. Because if we had 10% of the population or 10% of the businesses in the United States adopt the model that we are promoting and that we're using with our clients, that would get the attention of the big insurance carriers, and they would have to change their model in order to not lose more market share and to try to gain market share. So two things on that point. One is that I believe that guys and gals across the country that are doing what I'm doing, and the clients that I have and that they have, we are on the very starting edge. We're on the front of a blue ocean strategy, a blue ocean wave. That being said, kind of going back to how do we talk about this? There's a lot of businesses that they're just not ready for change yet. But the ones that are, they're on the front of this. I believe we're about 3 to 5 years ahead of our time. The things that we've talked about today, the things that I'm doing with my business, my clients, I really think in the next 3 to 5 years, you're going to start seeing those be more of a mainstream business practice.
I love it. Well, Nick, thank you for being on Healthy Savings. And I love the goal that you've set out, and I'm excited to see you do it, man. Like it'll take time. And if it's 12 months, if it's 24, whatever it is, I agree with you. We're at the tip of the spear here, and there's a lot that's going to change, and you're one of the few that's making it happen.
Sasha, thank you so much for the opportunity. Hope we brought some value for your audience, and I wish you the best week ahead of you.
Thanks for listening to Healthy Savings by Milu Health. If you would like more information about any of the topics you have heard today, we would love for you to get in contact with us. Find us on the web at miluhealth.com.